Welcome to The Explainer. Look, we've literally all been there. You're trying to finally get a good night's sleep, or maybe you're deeply focused on a project, or just trying to sit through a movie without missing the best part. And then, suddenly, you have to run to the bathroom. Again. Frequent bathroom trips are, well, they're incredibly annoying, but they aren't just a minor inconvenience. This can actually be your body's way of trying to tell you something really important. So today, we're investigating the Great Bathroom Trip mystery. And specifically, we're going to look at exactly why this is so closely linked to diabetes. Here is how we're going to crack this case today. First, we'll look at the bathroom trip mystery itself. Then we'll dive right into the science of polyuria. After that, we'll discuss when to suspect diabetes, rule out some other potential culprits, look at how this is diagnosed and managed, and finally, we'll cover exactly when you need to seek urgent care. We are going to solve this step by step.
Okay, let's dive into this. Section 1, the bathroom trip mystery. So the absolutely crucial point we're investigating today starts with a really simple, really frustrating question. Why so many trips to the bathroom? If you're finding that your daily routine is just constantly interrupted by the urge to go, you are actually experiencing a biological signal. It's a sign that something inside your system is working major overtime. But before we get into the why, let's quickly ground ourselves in the right terminology. The actual clinical term for this is polyuria. Now, this doesn't just mean going frequently, it specifically means producing and passing unusually large amounts of urine. It's a really key distinction, right? Because it points us directly toward what's actually going wrong in your body's internal filtration system. Which brings us to Section 2, the science of polyuria. Let's shift our focus and investigate the biological crime scene happening right inside the kidneys. Let's break down this fascinating biological chain reaction. Step 1. Your blood sugar, or glucose, levels become way too high. Moving to step 2, your kidneys, which essentially act as your body's natural filters, try to step in and rescue you by removing that excess glucose from your blood. Step 3 is where the real mechanism kicks in. It's a process called osmotic diuresis. You can think of glucose like a giant magnet for water. As your kidneys excrete that sugar into your urine, the sugar literally pulls extra water right along with it. And finally, step 4. Because all that extra water is being actively dragged out of your system, you get a massive increase in urine production, which ironically leaves your body completely dehydrated. And this brilliantly illustrates exactly what's happening to you. Because of that magnet effect pulling all that water into your bladder, you aren't just going to the bathroom more often. You are passing much larger amounts of urine every single time. Your body is just frantically trying to flush out that excess sugar. And the sheer annoyance you're experiencing, that's just a direct mechanical result of that internal process. All right, Section 3, when to suspect diabetes. We have our main clue, but now we need some corroborating evidence to build a stronger case. So we know about urinating more often, especially at night, which doctors call nocturia, and passing large amounts of urine. But look at how osmotic diuresis triggers this massive cascade of other issues. Because you're losing so much water in the bathroom, you naturally experience excessive thirst and a super dry mouth. It's a total domino effect. That sudden dehydration and lack of cellular energy can also lead to intense fatigue and even blurred vision. In type 1 diabetes specifically, you might also see unexplained weight loss. It is all deeply, deeply connected. Let's compare this for a second. Isolated frequent urination is one thing, but frequent urination coupled with a whole cluster of specific warning signs, that's a different story. If your bathroom trips are accompanied by constant thirst, increased hunger, slow-healing cuts, frequent skin or urinary tract infections, or maybe a tingling and numbness in your hands or feet, well, that is exactly when medical sources strongly suggest you should consider getting tested. It's the combination of these clues together that really builds the case for diabetes. Section 4, other potential culprits. Like any good detective, we have to impartially rule out the other suspects so we don't cause any unnecessary panic. Look, frequent urination is not always due to diabetes, and it's incredibly important to look at the full picture here. There are several other very common reasons you might be running to the restroom. It could be something as simple as a urinary tract infection, or frankly just drinking way too much coffee or water throughout the day. It could also just be a standard side effect of diuretic medications, water pills. In men, an enlarged prostate is a really frequent culprit. Overactive bladder, pregnancy, and certain kidney diseases can absolutely cause these exact same physical symptoms. So while diabetes is a prime suspect, it's definitely not the only answer to this mystery. Section 5. diagnosis and management. Let's see how doctors officially close the case.
A healthcare provider has a few highly specific testing tools at their disposal to build a definitive diagnosis. A fasting blood glucose test checks your levels after you've refrained from eating for a while. Then there's the HbA1c test, which provides an average of your blood sugar over the long term. A random blood glucose test checks your levels exactly at that current moment, completely regardless of when you last ate. And finally, a urine test can check directly for the presence of glucose, ketones, or an underlying infection, cleverly ruling out things like UTIs in the process. If diabetes is actually confirmed as the root cause, the treatment shifts entirely to controlling your blood sugar. This involves healthy eating, regular physical activity, and weight management. Medical interventions might include prescribed diabetes medications or insulin, right alongside regular blood sugar monitoring. But you know what the absolute most reassuring part is here? As you successfully manage that root cause and your blood sugar improves, that annoying frequent urination often just decreases right along with it.
Section 6. When to seek urgent care. It's absolutely crucial we slow down for a second here to clearly understand these medical red flags. If you're experiencing frequent urination alongside any of these severe symptoms, you need to seek immediate medical attention. We are talking about extreme thirst and severe dehydration, vomiting, sudden confusion or drowsiness, and difficulty breathing. Furthermore, if you are already monitoring your blood sugar and it is persistently above 300 milligrams per deciliter, that's a massive urgent sign. But pay particular attention to that last point, fruity smelling breath. This is a highly unique symptom, and it can be a sign of a very serious, life-threatening condition called diabetic ketoacidosis. If you notice this, urgent care is required, no second guessing. So, to summarize the absolute core takeaway from our explainer today, frequent urination is often one of the earliest warning signs of diabetes. It all goes back to that wild process of osmotic diuresis, high blood sugar basically forcing your kidneys to flush out glucose and aggressively dragging your body's water along with it. If you notice persistent polyuria, especially when it's combined with excessive thirst or unexplained weight loss, getting your blood sugar checked promptly is for sure the most logical and effective next step you can take. Which leaves us with this final thought. Frequent urination is your body's early warning system, acting exactly as it was designed to. The clues are all there, presenting themselves clearly in your daily routine. The only question is, are you listening to it? Thank you so much for joining me for this explainer, and remember to always pay attention to what your body is trying to tell you.